Welcome to the UT Health East Texas Virtual Education Series. Today's presentation topic is stress management and self-care in the time of COVID, featuring Dr. Halle Ross-Young, psychologist at UT Health East Texas Behavioral Health.
Hi, I'm Dr. Halle Ross-Young, a licensed psychologist and assistant professor in the Department of Psychiatry and Behavioral Medicine with UT Health Science Center at Tyler. Today I'll be doing a brief presentation on stress management and self-care in the time of COVID-19. Today's presentation objectives will be to talk briefly about the impact of COVID-19 on psychological functioning, as well as to talk about stress management and self-care tips and available resources in the community. COVID-19 was declared an international public health emergency by WHO in January of 2020. So we're coming up on nearly a full year of this time of pandemic with COVID-19, and it's really been unprecedented for many people, especially here in the United States. But we've noticed a widening burden across continents and across the globe in a diverse range of areas, including health, lockdowns and home restrictions for people. There's been a financial and economic burden, and then the burden of isolation, anxiety, and distress for those who are in areas that have stricter lockdowns. So what is the specific psychosocial impact of COVID-19? There's a possible stigma of corona positive, people who have been diagnosed or who are currently diagnosed as COVID positive. We saw this somewhat after the SARS breakout or pandemic in the early 2000s. And while research is still pending, this is a possibility that we have to consider, especially moving forward, how individuals who have contracted COVID, even if they have cleared it, they're back to work, how they might be impacted in the future. Immediate psychological effects of COVID and the lockdown include irritability, fear and confusion, anxiety, poor sleep, depression, even some paranoia, and suicidal ideation and risk of suicide, and this increased isolation. So it's very important that as mental health professionals and as a medical field that we're responding to COVID-19 and we're checking in on our patients and on our population. More long-term effects that are possible, obviously this research is still being conducted, are symptoms consistent with post-traumatic stress disorder and obsessive-compulsive behaviors, especially with hand washing or disinfecting, and engaging in some of these behaviors compulsively or to the point where they become interfering with that person's daily life and functioning. We also see depression and apathy as possible long-term effects of this COVID pandemic. Social effects include isolation and rejection, as well as the spread of fake information on social media or on the internet, which really increases people's fear and anxiety during this time. And so one of the ways that we can kind of assist our patients and our community is to be sure that we're spreading accurate information, that we're really answering our patients' questions about COVID, about treatment, so that they're not bringing in information that is unreliable or that is sort of the fake news variety. We also have seen panic, right? When COVID first started, you couldn't find toilet paper anywhere. And, some of these things were just, bread and things were being snatched off shelves because people were in a panic. And this can have lasting impacts on people as well, the state of anxiety and panic, especially being as prolonged as it is. And another consideration socially is kind of this element of racism or xenophobia with regards to the fear. So initially, some people were very concerned about COVID and its relationship to Asia or people of Chinese or other Asian ethnicities. And that resulted in some hate crimes and some violence towards individuals of that ethnicity. And so it's also really important to make sure that we're talking with our patients and we're assuring them that this, COVID is not related to any particular ethnicity or to any particular country or continent. It's something that the entire globe is struggling with right now. And really doing our role to reduce that spread of misinformation. Particularly, we want to think about how COVID-19 impacts our vulnerable populations, like our children and our elderly adults. For children, this is a time of massive transition. Many of them were virtually homeschooled and may still continue to be, and that could result in poor socialization. And so we want to think about, even during this time of isolation and lockdown, what we can be doing for our children, specifically young children, to improve their socialization. And to address their fear and confusion, to note for them that these emotions are valid, and to provide them with age-appropriate answers to questions that they may have about COVID or lockdown or other things that may be going on. You may even see some irritability, hostility, or increased conflict between, your children or your child and some of their friend group or peer group. Often what we see in children can be that when they are experiencing fear or depression, it can look like irritability or hostility. And so thinking about what we can do with our children to give them age-appropriate information and help them understand what they're feeling and what they're experiencing. Academic impairment is also a particular concern for our children and adolescents because of the transition to virtual classrooms and online learning. Some children have struggled with this transition, and some children who are receiving accommodations in the classroom may not be getting those same accommodations at home. And the burden really falls on the parents, who may also be working and trying to juggle many things at this time. And so thinking about how we can help our children, online tutoring options, or really looking into the resources that may be available for our children who are having a difficult transition to online learning is important. And we want to be talking about this with our children to reduce the possibility that they may develop post-traumatic stress symptoms, anxiety, phobias, or some of these obsessive or compulsive symptoms that I talked about over the long-term duration of isolation during this pandemic. And at the end of this presentation, I'll have a slide with some different links and ideas of places that have great resources that are age appropriate for our children. For older adults specifically, we want to think about the excessive fear and isolation that they may be experiencing because they are one of the more at-risk populations. The burden has really been on our older folks to isolate, to stay home, to take care of their own health and safety, which has come at the cost of increased loneliness, increased depression, and for some, increased suicidal ideation, or even risk of suicide. And so if you have elderly loved ones or elderly neighbors in your community, thinking about ways that you can safely interact with them and that you can increase that contact and be on the lookout for some symptoms of depression and anxiety is really important. As well as thinking about perhaps, their sense of helplessness and their excessive fear related to health concerns. So, how can we help encourage others in our family or in our community to disinfect appropriately and to social distance or to mask, things of that nature so that our elderly folks can be safe and can reduce some of that personal burden that they're experiencing. On this slide, I just have an image of some of the factors that contribute to the decrease in subjective well-being for people during this time of COVID, as well as some particular protective factors, such as resilience and social support. And we'll talk a little bit more about those protective factors on the next slide. So social support is one of those protective factors, and it's been associated with reducing the likelihood of developing psychiatric conditions, even apart from COVID, as well as playing a supportive role in reducing the likelihood of developing these symptoms and conditions as a result of COVID or during this time of COVID and lockdown. Resilience is defined as a person's ability to support or retrieve psychological well-being during or after stressful or disabling conditions. So people have different levels of resilience and may respond differently in different situations. But what we found in COVID specifically thus far is that resilience is really enhanced by general messages of hope and social protection. So, one way that we can enhance resilience for our patients, for our family, for our community, is to encourage people not just to focus on the news or scary stories or news articles that they may be reading, but to look for opportunities to read about, to hear about, to engage with hopeful stories in the community, ways that people are helping each other, positive messages, and to build that sense of community and resilience. For the next slide, for stress management and self-care, there is a particular approach developed by Russ Harris called FACE COVID, which is an acronym. So each letter stands for a different skill, and I want to talk about those with you today. The first in FACE is the F, which stands for focus on what is in your control. When it comes to COVID, there are things that are outside of our control, and it's important to know what those are, right? What the government decides to do, what our company decides to do, even what other people in our community are doing, some of those things are outside of our control. And so when we spend a lot of time engaging in worry or anxiety about these things, we can't do anything about it. It really increases our anxiety level and we begin to feel overwhelmed. If we're able to take the stance of recognizing what is outside of our control and acknowledging that even though it may frustrate us, it's something we don't have direct control over, and to turn our attention to the things that we do have direct control over, can actually reduce some of those feelings of overwhelm and anxiety. So what do you have control over? Your own masking, your own social distancing, your own disinfecting. Right, your decision to engage in activities of daily living, doing a load of laundry, getting up and taking a shower, even if you're working from home. Even if you're working from home, maybe putting on work clothes instead of staying in your jammies all day. That might be something that helps you feel better, and that's something that you have control over that you can choose to do. And so when we turn our attention towards those things that we can impact, that we can affect, it can help reduce some of our anxiety. So really thinking about distinguishing between what's in our control and what isn't. So focus on what is in your control. The A stands for acknowledge your thoughts and feelings. So for many of us, this is a pretty confusing time, and perhaps we're not really sure exactly what we're thinking or feeling. This requires a little bit of internal reflection, right? What is it that's really going on for me right now? I feel frustrated, I feel confused, I feel scared. And instead of judging ourselves for that experience, instead of telling ourselves we shouldn't feel that way, just acknowledging it and saying, I notice that I'm feeling that way, or I notice that I'm having a thought that, I'm confused about what to do for work, or I feel overwhelmed. When we just notice that we're having it and we say it's okay to think that way, or it's okay to feel that way, it can really take the pressure off of ourselves. As I mentioned, this is an unprecedented time, and these responses are normal. Feeling irritable, feeling confused, feeling frustrated or anxious or sad or lonely, it's normal. And allowing ourselves the space to have those feelings is important. The C stands for coming back into your body. And there's a way to do this, multiple ways, so find one that works for you. But after acknowledging our thoughts and our feelings, it's turning our attention to our physical body. And to come back into our body, you could do this in several ways. Taking a few slow, deep breaths. Perhaps you like to press your fingertips firmly together. You can do this a few times. Doing some stretching. If you're seated, you can press your feet firmly and slowly into the floor, but really bringing your full attention to your body and whatever sensation it is that you're engaging through your chosen method. Really noticing and bringing my full attention to the pressure on my fingertips, what it feels like, what I'm doing. And that's a way to bring our focus and our attention to our body, to our physical self, and to get our mind away from some of those other thoughts and worries that are happening. And the E stands for fully engage in what you're doing. So for many of us, and I know that I'm included in this, our mind likes to stay really busy, and it tries to think about many, many things all at once, which can be pretty overwhelming. One way for us to fully engage in what we're doing is to bring our full attention to one thing at a time. If that's taking a walk, you can do this by walking outside, noticing what the trees look like, what the birds sound like, what the wind feels like on your skin. And you're bringing your full attention to that time of walking and your sensory experience, rather than letting your mind wander to things that you need to do, things that you're worried about, other things that are going on in your life. If those thoughts pop up, that's okay. Tell yourself it's okay, but bring your mind back to your task at hand. And that could be a walk, it could be doing a load of dishes, whatever you like, but find a way to fully engage in what you're doing and give your brain a break from some of these worries and frustrations about what's going on in the world around us. So our C in COVID is commit to your values. So for many of us, we may go through our lives, or our day-to-day lives at least, without really giving a lot of attention to the things that are important to us, the things that are meaningful. When we take time to identify our values, they're things that kind of guide us in the direction that we want to be in life, we can have the opportunity to stop and think about moving in that direction, even in the face of something like COVID. So perhaps for someone, a value might be being a loving person. And if we identify and commit to that value, one way that we can be a loving person might be making sure that we reach out through phone calls or text messages to family who live in a different part of the country, or to that elderly family member that we know lives alone and feels lonely. Being part of our value of being a loving person is reaching out and making that effort. O is opening up. It stands for opening up to our experiences. And so when we open up, we're allowing ourselves the opportunity to take in and experience everything that's happening around us. And to balance that with that acknowledgement of our thoughts and feelings, right? There are a couple of different methods for doing this, and in the slides there's a link that you can follow that has some good ideas regarding self-compassion and some other methods that we can use to fully open up and acknowledge our own experiences, our internal experiences. And the V in COVID is for valued action. As I mentioned earlier, when we identify and commit to our values, we can then engage in valued action, or things that are consistent with what's important to us. So if being a loving person is a value, reaching out to that isolated loved one, that is valued action. Perhaps disinfecting or making sure that you mask when you leave your home is also a valued action, because you're being loving towards the other people in your community. If health is a value for you, making sure that you're disinfecting, your home, you're wearing your mask, these are valued actions, just like making sure that you're engaging in self-care would also be a valued action for maintaining your health during this time. And the I stands for identifying resources, especially, as I mentioned, with all of the misinformation that's out there with COVID and with how new everything is. There are a lot of people that just aren't aware of the resources that are available in our communities and nationally. And so in later slides on this presentation, I'm going to provide a list of some different resources that are available that you can seek out, you can recommend to your loved ones. Find what's helpful for you, because there are resources out there. And then the D stands for disinfect and distance. So throughout this pandemic, even as we're managing our stress, we're trying to engage in self-care and find valued activities that we can engage in, even in isolation or, home restriction. It's still important that we continue to disinfect, we continue to distance appropriately, to mask anytime that we leave our homes. If we are still going into work in person, that we're being sure to maintain appropriate social distancing and masking at work, disinfecting our workstations or any things that we may come into contact with, so that we can help slow the spread of COVID and end this pandemic and do our part. So on this slide, I have a list of some resources that are available. One that I really want to call particular attention to is the COVID-19 mental health support line. This is a number that's available 24/7. It's free of charge. You can call it and there will be someone available to speak with you about any concerns that you have or any struggles that you're having related to COVID or isolation or fears or questions that you have about COVID. Another number that's very important is the National Suicide Prevention Lifeline. This number is also free and available 24/7. It has this hotline number as well as a text number, and you can contact either of these 24/7 and speak with someone who's supportive and understanding about any struggles that you're having, any thoughts that you may be having of harming yourself, or any plans that you may be making or concerns that you have. These are individuals who are trained and who are ready to support you and to help you get the care that you need and provide you with the support that you need. Additionally, there are other resources, hotlines available, and websites with more information that are listed here on this slide. On the next slide, I have some resources specific for children and families. So if you are a parent or you have nieces or nephews, or you're a teacher and your children are asking questions, these can be some great resources that provide age-appropriate information about COVID, about isolation, about disinfecting strategies, so that children feel less confused and they feel more empowered to take part and do their part in reducing the spread of COVID. And so these are some great resources for children and their families. This final slide are the references, as I mentioned earlier, that this presentation was developed from. Here are a few questions that we received. How can you deal with stress at work during COVID? Great question. I think one of the most important things is identifying a supervisor or a coworker that is supportive, that you can talk with about your concerns. Being in a supportive environment really makes all the difference. And doing what you can and encouraging others at your job site to do what they can as far as masking, disinfecting materials that are used if you're still going into the office during this time. If you're working from home during COVID, one of the ways to really manage that stress is to keep and establish a routine. Finding a place in your home that's going to be your designated workstation, instead of letting your workstation kind of be anywhere in the house. It can reduce stress, and if I'm at this desk, I'm doing work. If I'm anywhere else in the home, I'm off work. It can really help reduce some of that stress and that boundary bleed between work time and at home time. And keeping that routine as well is really important. So waking up, working your designated hours. During times like this, it can be easy to maybe start work late or work later than normal because we're at home, but try to keep those boundaries and that routine established. We also received the question, how do you manage the fear, anger, and anxiety of having COVID? I think that's also an excellent question. Because the presentation of COVID is so different in different people. Some may have few or no symptoms, and some people may be quite symptomatic. Once diagnosed, I think it's important to follow your doctor's advice and to quarantine appropriately, treat your symptoms as best you can, and to seek medical care if you're feeling worse or if things are getting worse as soon as possible. For your own safety and for the safety of those around you. If you're living with other family members or roommates during this time, I think it's also important to talk about what that quarantine will look like while you're symptomatic. If you have someone who can help you, with grocery shopping or with disinfecting around the house, things of that nature, it's important to identify that that person, and to make sure that you're taking care of yourself, not just physically, but also mentally and emotionally during this time. When we're not feeling well, it's easy to allow ourselves to really focus on that fear, that anxiety, or that frustration. So finding things that you enjoy that you could do even from your home. If that's a favorite comfort show on Netflix, if that's a hobby that you have that you still feel well enough to do, coloring or crafting, whatever that may be. Those are things that can help you manage some of those emotional responses to being diagnosed with COVID. We also received the question, how do you deal with isolation during COVID? This is something that a lot of people have been struggling with these past few months, especially as the pandemic continues on over the course of several months. The isolation and the loneliness can really take a toll for people. And so finding creative ways to get that social interaction is very important, particularly if you live alone and you're working from home. For some people, their faith organizations or community support groups have moved to virtual platforms. And if that's the case for you, finding a way that you feel comfortable to call in and to participate in those things as you normally would, even if it's from home. Or finding and scheduling times with family members and friends for Zoom calls or FaceTime or whatever it may be, so that you still feel connected and you're scheduling fun things together. At my previous hospital, some colleagues and I had a Zoom trivia night that we scheduled every so often. So we got together and played games. And even though we weren't together in the same space, it was still something that was fun and really built that social interaction. So finding creative ways to socialize and to reduce that sense of isolation is important. I think also reminding yourself and the other people in your lives that the more that we do now to keep ourselves and to keep others safe and reduce the spread, hopefully the shorter duration will remain in isolation. And so reminding ourselves that there is a purpose for what we're doing, even if it's tough in the short run, can be helpful for managing that isolation.
We hope you enjoyed the presentation today. For more information about scheduling an appointment with one of our mental health professionals, call 903-877-7168 or visit uthealthiestexas.com. Our next virtual seminar will be announced soon. Follow us on Facebook to stay up to date on upcoming events and seminars. Thank you.